This is Dentistry Disrupted with Dr. Craig D. Clayton. I'm a wellness and biomimetic dentist, passionate changemaker, social media thought leader, and educator on disrupting the way we approach oral healthcare. Come along with me as we journey towards a healthier and more empowered you. Welcome back to Dentistry Disrupted. I'm Dr. Clayton, and today we're diving into a topic that's close to my heart, the root cause of common dental and airway issues in kids. We'll uncover why so many children end up needing braces, why inflamed tonsils are more than just a nuisance, and how early intervention tools like MyoBrace and Tooth Pillow can save your family time, money, and a whole lot of stress. So without further ado, let's get into it. When parents hear their child might need braces, the first assumption is usually, well, it's just genetics. But here's the thing. Dental crowding isn't purely genetic, it's functional. The primary cause? Poor tongue posture. Your child's tongue should naturally rest against the roof of the mouth, gently expanding the upper jaw as they grow. When that doesn't happen, maybe because of mouth breathing, a tongue tie, improper swallowing patterns, the upper jaw doesn't develop fully, and what happens? Not enough space for teeth, leading to crowding. Braces might straighten teeth, but they don't address the underlying cause alone. And without correcting tongue posture, those teeth can shift right back over time. And yes, there are other things that contribute to crowded teeth, but what I'm trying to say here is that tongue posture plays a pivotal role in the development of the jaw bones. And what's really interesting is that orthodontic treatment was one of the first specialties, and it dates back to the early 1900s. And the reason why orthodontic treatment was created was to address these airway issues, was to address the underdevelopment of the jaws. So orthodontics is so much more about just straightening teeth. It's a really important specialty, and orthodontists play a pivotal role in helping to make sure that your child has enough space for their tongue so that the tongue stays up and forward out of the airway and allows them to breathe properly day and night. Just like any specialty, not all orthodontists are airway focused. So it is important when addressing this issue that you find someone that understands the importance of tongue posture and tongue space, because this is something we have to achieve early. What I see on my end is a lot of adults that have very, very small jaws. And so while they have straight teeth from orthodontics, the root cause was not necessarily addressed, and they didn't end up having enough tongue space, which causes the tongue to sit more posterior, and there's just not enough room, which can compromise their airway. So while they were a teenager and they got straight teeth, they may have looked fine, but what I'm seeing is these adults grow and develop, and they become larger people, because when we're in teenagers, we're still pretty small. We're not fully developed. And so then there's other things that develop. Maybe the throat gets thicker, the tongue grows larger, and all of a sudden we have a compromised airway that's much harder to fix, because even though we can get better tongue posture, if we don't have enough space, it's going to make it a lot more difficult to get that tongue all the way out of the airway. And to address the root cause of insufficient space as an adult, it often requires surgery to really get the jaw wider to have enough room for the tongue. And we want to prevent that. That is why it's so important to address these issues early. Well, it's really easy to be able to get wider jaws, more growth and development before that jaw fuses. Because when that upper jaw is still developing, there's cartilage that connects the two sides, which allows it to change in size more easily. But once we go through puberty, that cartilage starts to disappear and those bones fuse together. That's why it's then so hard later down the road to make them wider. And sure, there's a lot of treatments that are advertised to be effective at widening the upper jaw for adults. But the reality is the bone that the upper jaw is connected to is really thick and large. And so to assume that an expander on an adult can widen the whole bone is flawed. So what we may see in adult is they get an expander and their teeth tip outwards and create some more space for the tongue, but then now they have bite issues. So doing surgery to actually increase the width of the entire bone is the best treatment, which is something that no one wants to go through. So let's spare our kids from more invasive surgeries down the road by fixing the problem early on, getting good tongue posture, getting good jaw width, so that this does not become an issue later in life. Now let's talk about those inflamed tonsils. It may be the pediatrician that first recognizes those inflamed tonsils and points them out. You may not notice as a parent, but some risk factors that may point out that there's an issue are things like your child snoring, they're breathing loudly either at night or during the day, or they seem perpetually tired no matter how much sleep they've gotten the night before. So one of the biggest culprits of these inflamed tonsils is mouth breathing. When children breathe through their mouth, or adults breathe through their mouth instead of their nose, it dries out oral tissues, and it also bypasses the nasal immune system. This introduces unfiltered air into the airway and triggers inflammation in the tonsils because they're working overdrive to be able to clean that air. Versus when air goes in through the nose, you have mucus, you have all sorts of different things that help to filter out the air before it gets to those tonsils and down into the lungs. But it's not always just mouth breathing. Factors like allergies, diet, and even oral habits play a role. The key here is recognizing that these aren't isolated issues. Enlarged tonsils and mouth breathing are signals of an airway problem that needs to be addressed or an allergy issue that needs to be dealt with. So I have a patient that had chronically inflamed tonsils, and she's about 5 years old, and the pediatrician saw that they were inflamed and said to the parent, you may need to get her tonsils out in the future if they stay large because she'll keep getting sick, she'll have more issues. Well, this parent understood. Well, first off, this parent is a myofunctional therapist, so she understood that her child was breathing through her mouth, especially at night. So what did she do? She focused on the root cause. Through minimally invasive treatment like myofunctional therapy and using a MyoBrace appliance, she was able to help her child achieve nasal breathing day and night. And down the road, when she had a follow-up appointment with the pediatrician, he looked in her mouth and said, wow, her tonsils look so much better. What did you do? And the response was, she's breathing through her nose now. That is the power of breathing through the nose. And something very, very interesting is we have studies that indicate that when we switch from mouth breathing to nasal breathing, that the rate of asthma, allergies, seasonal allergies, sickness decreases because we are filtering that air and we are introducing less allergens into the lungs, which then cause issues. Modern orthodontics is shifting back to this airway first philosophy, and that's where tools like MyoBrace and Tooth Pillow come in and are very helpful in addressing the root cause. Did you know that the original purpose of orthodontic treatment wasn't just straight teeth? It was actually about creating healthy airways and properly expanding the jawbones. Straight teeth are great, but if a child or an adult can't breathe properly at night, those perfectly aligned teeth aren't going to fix poor sleep quality, chronic fatigue, or even behavioral issues linked to poor oxygen intake at night. In summary, orthodontists are very important specialists that will help your child not only have straight teeth, beautiful smile, but more importantly, develop proper sized jaws so that their tongue has room to fit between their teeth to get that tongue out of the airway, especially when they become adults and they finish those final stages of development in early adulthood. MyoBrace and Tooth Pillow are game changers for early intervention. These devices are designed to guide proper tongue posture, encourage nasal breathing, and even support proper jaw development, all starting as early as age 3. Instead of waiting until all the adult teeth come in, these tools allow us to intervene early, creating space naturally and avoiding more invasive treatments later on. What's critical to understand is these appliances need to be used in conjunction with myofunctional therapy. When used alone, they won't fix the problem. They simply reinforce habits at night to encourage proper tongue posture and apply some gentle pressure to those jaws to encourage expansion. If these appliances are used without myofunctional therapy and body work, we will not achieve the intended result. It's not just about teeth. It's about setting up your child's airway, sleep, and overall health for success. If you're a parent listening to this and thinking, wow, I wish I'd known this sooner, it's not too late. Addressing airway health early can prevent a cascade of health issues down the line. If you're curious about whether MyoBrace, Tooth Pillow, or an airway-focused approach might be right for your child, reach out to a provider who understands these root causes. And if you found today's episode helpful, share it with a friend, subscribe to the podcast, and let's keep spreading this knowledge. Thanks for tuning in to Dentistry Disrupted. I'm Dr. Clayton, and I'll see you next time as we continue exploring how dentistry connects to whole body health. Take care. And now for some legal jargon, I need to remind you that this information is intended for educational purposes only. To diagnose and evaluate to see if you or your child has an airway issue, please consult with a professional.